Hi, my name is Courtney Crane, and this is my video submission for my healthcare policy brief assignment. Registered nurses frequently come in contact with health policies that pertain to their everyday practice. Healthcare professionals in general should continuously increase their knowledge on various healthcare policies so that appropriate care can be given within their hospital system. Health policies are multifaceted entities that affect both patients and healthcare providers. One recent health policy, in particular, focuses on smoking at California state beaches and parks. So why did I choose this healthcare policy to review? I chose this because smoking remains the leading cause of preventable deaths and disabilities in the United States. It causes harm to almost every organ in the human body. More than 16 million Americans live with a disease that relates to their smoking, which costs the government billions of dollars in healthcare-related costs a year. Smoking can cause lung cancer, heart disease, stroke, lung diseases, diabetes, COPD, and erectile dysfunction, just to name a few. It also increases the risk of tuberculosis, eye diseases, and other immune problems. Additionally, people who don't engage in smoking but are nearby other smokers can also have detrimental health issues caused by inhaling the smoke. Secondhand smoke increases the risk of having strokes, lung cancer, coronary heart disease, sudden infant death syndrome, middle ear disease, respiratory diseases and symptoms, and stunted lung growth. It is clear that both smoking and secondhand smoke pose a large and dangerous threat to the health of every American. California legislators in the past have accepted and passed numerous healthcare policies to try and limit those who are smoking, especially in public places, but it is obvious that additional regulations are necessary to create a more positive change. So a recent healthcare policy was identified and introduced on February 22nd of this year, 2019, by a California Assembly member named Mark Levine from Marin County. He introduced this legislation that would ban all types of smoking at all California state beaches and parks. This bill is titled AB 1718. If passed, offenders will receive warnings and fines. This new policy has been proposed in hopes to protect both the public's health and the surrounding environment. If passed, this law will be a dramatic yet beneficial statewide regulation that will contribute to decreasing the negative effects of smoking. This bill is still in the legislation process, but it does look like it's very hopeful it'll be successfully passed. Currently, the State Assembly has reviewed the bill 3 times and has voted twice. Both times, the yes votes heavily outweighed the no votes. Even more recently, on July 10th, the California State Senate voted 7 yes and 1 no. So, it is clear that it is likely that this bill will likely be soon officially passed and put into practice. So, let's review the alternative options. The main alternative option is to not have AB 1718 passed, which means California state beaches and park visitors will continue to be able to smoke at these locations. Not only does this pose additional health threats, but it will also add to unnecessary waste and trash that litters state parks and beaches. In fact, a bill similar to AB 1718 was proposed in 2017 and was passed by the legislature, but later it was actually vetoed by former Governor Jerry Brown. This angered many California residents that believed smoking in state parks and beaches should be banned. It was assumed that Brown's political standpoint and supporters played a large role in this denial decision. So I would like to start recommending my opinion as a registered nurse. I always encourage people not to smoke, and if they do, to attend a smoking cessation class to try and quit smoking. It is clear that smoking causes so many detrimental health issues that are very disabling and even deadly. Smoking poses a large health risk factor for all Americans, and it should be limited when possible. This bill should be passed and encouraged because it will decrease the prevalence of people smoking in public places. Government legislation is trying to pass this proposed regulation because it will improve the health of many people. This hypothesis is actually already supported by strong evidence from the Centers of Disease and Control and Prevention. Studies have already shown that smoke-free laws that prohibit smoking in various locations have helped improve the health of those individuals in those locations. It was also found that health outcomes have been improved, such as health reductions of hospital admissions for heart attacks. This is incredible evidence that really supports the outcome of this bill. So in conclusion, I fully recommend the passing of this bill because it definitely should help improve health outcomes of the public. Health policies are made so that regulations can help people's health. This is an important health policy and it should be passed. Thank you.